Greetings, everyone, and thank you for joining today's webinar, Unlocking Care Management Success, Key Takeaways from Successful Providers and Medical Groups. Before we introduce our co-founder and CEO, we'd like to thank Veradigm for allowing us to be with all of you today as the June App of the Month. You can find us in the Veradigm Connect App Expo, where we are a platinum partner. The two medical groups we are featuring today are also Veradigm customers running some of the most successful care management programs in the country. They enjoy a robust integration with ChronicCareIQ that makes any care management program easy, scalable, and profitable. There are a couple of high-impact offers available to you in exchange for your participation in today's webinar. First, as a Veradigm customer, if you contract with ChronicCareIQ, you will receive free implementation and training. Second, we will provide a free financial analysis to you all for participating today, which will quantify the incremental revenue you can earn by enrolling your patients in CCM and RPM programs. If you registered for the webinar, you will receive a follow-up email from us with this financial summary. Okay, without further ado, please welcome ChronicCareIQ co-founder and CEO, Matt Ethington.
Hello, everyone. We're here with a couple special guests, and you're going to talk to us today about care management and what you should be considering for your practice. We've asked everyone to be candid, discuss the challenges as well as the benefits, what maybe has impressed them, what's left them underimpressed. And I will like to introduce Dr. Ross Hammock. He is a partner at Family Docs in Shreveport, Louisiana. I was especially excited when Family Docs entered the sales cycle, Dr. Hammock, because it's a 50-year-old practice. And that speaks volumes to me about leadership, shared vision among the team. And then when I looked at the robust level of services that you offer, it's clear that FamDocs really focuses on being the center of the medical community in your city. By the robust level of services that are offered, it really felt almost old-fashioned. Like you guys are really focused on your community and on your patients. I would love for you to introduce yourself and say something, and then I'll introduce Veronica.
Yeah, sure. Thanks for inviting me. Yeah, the practice is an independent practice, which is a dying breed these days. I've been with the Family Doctors for going on 16 years now. I've full-time provider, managing partner of our practice, and kind of spearhead some of the extras that we do. 85% of our patient populations are under some value-based agreement. And so that's a passion of mine to, drive great care, but also do it more cost effectively for benefits of patients and also benefits of payers. So, thanks for having me on.
Sure. Their website is FamDocs. If anybody wants to look at it, I'm sure you'll come to the same conclusion that I did. And Veronica, I think we have seen everything in care management, virtual care management delivery. And our team recently came back from your headquarters in the Detroit metro area. And the conclusion was that you run one of the most evolved digital care management businesses we've ever seen. As of, I think this morning, close to 14,000 patients. And tell us a little bit about yourself and about that, right? I was impressed too when I saw how you run that program, and I know that you're the brains behind it.
Yeah, sure. So with Epic Health, I started off in the call center. So I got to know like the different processes around the offices, basically inbound, outbound communication, as well as other things, which helped me when I got into the care management program on what we need to do to build it on the communication side of it. One of the biggest barriers that we've noticed is with patients is they don't answer. So how can we present the information to them without always having to reach out to them, because we know that they're not going to answer, or some people change their phone number, especially in the communities that we serve. Every month could be a different number. So how can we present that same information to them, whether it's a different type of communication through text, through mail, in-person events, certain things like that, to try to get them more engaged. So that's kind of what we started off as, is how can we get them engaged, and started off with that process and kind of built onto it, because that was our biggest barriers. Is the patients need it, but sometimes it's just hard to for them to get in front of us, and we want to be kind of that in between, like care management program between the visits, because they come in for a visit, so we want to bridge that gap in between. So that's kind of our focus, was that, and how to build protocols around it.
So it's not just tracking high risk patients, it's keeping all patients connected.
Yes, correct. And the population that we serve, they have a lot of like social determinants of health issues, whether it's like food insecurities, housing, transportation barriers, a lot of different things. We try to help them, and it's not just like whether you're in the care management program or not. Like, we assist them with that, as well as obviously our focus is the high risk. But the population that we serve, there's so many high risk, even if it's not only related to medical. A lot of the social determinants of health we assist with.
Great. Great thing. What, well, I'll move to my first question. One of the taglines that we use is grow with confidence. And we always thought, well, you can add an additional type of service delivery and that will help your practice grow. But do you feel care management, Dr. Hemmick, I'll start with you. Do you feel how is care management helping uh, your practice grow?
Well, I think it's how you determine grow. I mean, it certainly is, from an economic sense, it's certainly helping to drive new revenues that weren't appreciated before, and revenues that are meaningful. And what I mean by that is, we're helping to better care for patients through chronic care management. So, yes, the practice wins on a revenue standpoint, but yes, it's meaningful, impactful to patients, and that's something that we absolutely put a focus on in the investigation phases before we went full blown onboarding, to make sure that we were doing things for the right things and for the right reasons. And so it certainly helped us, grow in the service offerings that we offer our patients, and then also kind of tweak that a little bit. I would also say, Matt, grow in competence, right? I mean, we can competently better care for patients through a unique service offering that I think most providers, and certainly in our region, aren't able to provide for their patients. And I think patients sense that. It's new to them. They appreciate it. I mean, how we have designed care management for our enrolled patient populations is at least monthly check-ins, via phone, sometimes more often, depending on what the medical needs are. And I feel they greatly appreciate that, and feel that, we're able to keep more eyes and ears and fingers on them between our routine visits.
Yeah, well, great answer. Thank you. Um, Veronica, same question. Is it helping I know you were at a practice launch, I think this morning. So how is it helping your team in your practice?
Yeah, so when we first began, care management was more of like a supportive add-on, and today it's a core part of how we deliver value-based care, how to keep patients out of the facilities, high-risk facilities or high-cost facilities, reducing the medical loss ratio, certain things like that, that we've, depending on the workflows that we come across, we've helped minimize that, which is great. So our relationship with across payers, different providers, has definitely improved, based off of the care management services that we are performing. We have a lot of providers that refer, and we get them like right away, like responses within 24 to 48 hours. So I think that that gap in between their office visit and when they're at home makes a huge difference, because patients don't know certain things that we can help in the office, and they just go straight to their emergency room. So I think providing them with that education starting off, and kind of continuing to remind them that we're here, we're open, you can walk in, that has made a huge part, in having the patients come to us first before utilizing high cost facilities that might not need it in that moment, where we can kind of handle that. Because a lot of the issues that we've seen is patients are uncompliant with their medications. It's more like education. We try to get them involved, or the dosage changes, or certain things like that. We try to get in front of it instead of wait for it to get worse. So that's a little bit of what we try to focus on. And then with our new location that we had today was the ribbon cutting was actually in West Davidson in Detroit. It's a huge facility. It's really great to have it over there because it used to be a building that was abandoned. So, just seeing it and how it is now with all the renovations and everything that they've done is amazing. And that's one thing that I really like about working in this company is the population that we serve are in the areas that need it the most and the patients that need it the most. And so that's kind of the passion of care management is how can we go above and beyond to help these patients in the underserved communities.
Well, both of your responses, they touch me because part of the vision for the company was based on I was determined. I guess I was diagnosed in the emergency room, and it was rather dramatic. They told me I was days and maybe hours away from being in a coma with type 1 diabetes, and I hadn't seen a doctor since I was on the swim team in high school. So just being at home thinking, oh my gosh, I have to poke 5 holes in myself every day from now on for the rest of my life. What does this mean? And finding a doctor and all of that stuff. There was just a lot of anxiety and a lot of things to get used to. But I remembered after I talked to my doctor, I always felt better. And when we established this company with the mission of to relieve suffering, a lot of it, honestly, to me, it's about those patients knowing that their doctor has their back at a very critical time, right, in a very confusing time. So I applaud both of your practices for again. I think every doctor wants to do that, but I'm really impressed. Thank you. What would you, Dr. Hammock? What would you? I think you did more due diligence on your care management solution. I'm 55 years old than anything I think I've ever represented in my life. So people should hire you as a negotiator. Tell me what you would recommend other doctors do, right? And if you're thinking about doing something around care management, what would you say you did right? What would you do differently?
Well, I think they need to ask themselves why do it to begin with. So ask the why. Why are we going to do this? What's the aim of it? How do we best get there if that's what, once we define the why and once we define the aim. That may seem like a vague question, but I think it's very, very important to ask that because what are you trying to accomplish? With chronic care management, there's different ways to do that. There's different ways to deliver that. And again, it's certainly financially incentivizing to do so if you do it full scale, pedal to the metal. But the question is, are you going to do it in a meaningful and impactful way? Are you going to do it in a way that's going to drive better outcomes? And are payers going to recognize your efforts as being high value as well? And so as we get further and deeper and years of experience of value-based programs, that's what kind of came to front of mind for me. It wasn't just about how many patients do we have, how many can be enrolled, what's the top line revenue look like. To me, it's how do we do this the right way, enroll the people who are the highest risk and the most of need of extra touches and extra listens during the month, so that we enroll the right people who need to be in a program like this. So I think for other practices considering this, it is, we're all burnt out. Administrative, burden and overhead is only going to grow. It's not going to shrink. Burnout medicine is real. There's harder and harder ways to drive extra dollars and extra monies with the way the reimbursement system is set up in the United States. And so having something that can drive extra revenue that can meaningfully impact patients and allow us to deliver better care than what we could do prior, I'd say is a win all around. Practices win financially. Practices win from a satisfaction standpoint. We're more pleased because we're able to do more for our patients in a way that doesn't require more to be crammed into a 15 or 20-minute office visit time slot. I think patients recognize value to that because they feel like, man, my doctor, my provider is reaching out to me on a routine, regular basis to check in on me. So I feel like I do have a little safety net below me when they could be floundering out there without something like that. So I think for practice is considering it, I think there's different, elements to look at: the economic benefits of it. What does the workflow challenges look like? But at the same time, make sure that all the incentives and all the attractions make sense for doing it the right way and for the right reasons.
Yeah. Have patients said anything to you about it since they've been enrolled?
Extremely pleased. Extremely pleased. Our program is a little bit unique in the sense that we partnered with another company called Mycema, who Blake put us in touch with, and Poonam, one of their co-founders, and I hit it off immediately. Immediately felt the her aim to do things the right way and for the right reasons certainly fell in line with how I envision things going, and so certainly doing it in house is absolutely doable. I think I had a lot of projects on my plate for a very, very long period of time. And anything I do just in life, I'm going to do it to the best I can in the most excellent way possible. And I think it was hard trying to envision starting a CCM program that was going to be robust and meaningful and thorough in the way that I would like to see it go, with the other distractions of full-time clinical practice and other things going on. So I think that's why I was a little bit not delayed, but methodical and considering how best to do it. And I think when Blake introduced me to Poonam, we hit it off immediately and really took the onboarding challenges and struggles off my plate, to go to somebody who has experience, the same passion I do, for caring for patients in a higher level way than what I can currently do. That enabled us to just roll into an onboarding period where patient enrollment just really took off immediately. And again, very minimal impact to my workflow, but very, I think, meaningful to patients who are being enrolled.
Great. And Veronica, I'll ask you the same question, but also make the announcement that you are beginning to offer similar services to other doctors' practices, correct? You're adding your care management skill set and making it available to other practices to hire your team to do that for their patients. Is that right?
Yes, that's correct. Some of the feedback we've heard, from other provider groups is they want to do the program, they just don't have like the bandwidth to do it. So that's where we come in, is providing those services to those patients. And it's very simple. Like the only responsibility that really the other provider would have is just the billing. We handle all the work. We handle reaching out to the patients. We handle the billing reports, the quality checks and quality assurance. So everything we handle within care management business entity, which is United Care Management. And then, the rest of it is just handed off to the other provider to bill. It's a very straightforward process. It can be done like within 3 days just to have it live and up. So yes, we are looking right now. Our patients, we have thousands of patients in care management that are in Michigan, but we are looking to expand across the United States.
I think you're in 3 states already. So
Yes, we have
congratulations.
one in Illinois, and then we're looking at other markets like Ohio, Florida, Texas. So we're growing, and we're hoping that as provider groups that need it or that want it for their patients that don't have that capability to handle that, we're more than happy to take that on.
Yeah, that's great. So what do you think you guys did right when you started, and what would you do differently?
Yeah, so a couple things that we did right is kind of building standard operating procedures from day one around QA, QCs, care plan documentations. That's one of the biggest things is the quality assurance, quality controls, making sure we have the proper consents, making sure we have the proper documentation, everything aligned is, billing. So, nothing comes back, providing that value, providing that patient satisfaction. And then, going from there, a lot of what we do is we started off like small. What I would suggest is to start small, prove success, and then scale. And that's what we did. It's, instead of having a lot of things all at once, it's kind of taking small steps and building it until you get to a point where you see that success, you see that patient satisfaction, you see the reduce of cost, quality, social determinants of health. And then once you prove that success is when you start want to scale, is what I would recommend. Going like very head on first can kind of delay the process, can kind of delay a lot of things, is what we've noticed. So starting off a little small, building it up, will be huge. And then, like Dr. Hammock said, understanding your goal. If you do not know your goal, it's hard. It's going to be hard to be able to adapt it with everyone else, or if it doesn't fit in your current processes. So that is the one thing: is what is your goal with this? What do you want, and then build on to that.
Right. Well, I just have one last question. Is like, and it's simply a yes or a no question. I'm not fishing for compliments, but would you recommend our team and our product again, or would you recommend them to others? Excuse me.
Yes, for sure. So, with Chronic Care IQ, it was built by like people who are trying to understand the workflows, the different protocols, clinical. So it's not just like here's the data, here's this. It actually have alerts depending on what the patient responds to be able to follow up, and also just the support from the team, being able to grow with us based off of some enhancements that we want to add. So I really appreciate that. Based off of the meeting when. A couple of the team members were here talking about the enhancements and what we could do to kind of partner with one another and just build the system and keep building onto it to make it better, more efficient for anyone else to come through.
Well, I looked at the Medicare data this morning. You run one of the 10 largest CCM practices in the country. So congratulations.
Thank you.
Dr. Hammock, I incredibly impressed with your business acumen and obviously as well. I love the practice, right? It seems like it lives in a more genteel era of medicine. Would you recommend us?
Oh, absolutely. Even when we were in our stages of investigation, do we do this ourselves in house? Do we use a partner? One thing that was quickly apparent is just I guess just the ease of functionality and the simplicity of the software, where it requires minimal training to even the most technology averse provider. I mean, this takes no work, no onboarding to do. It meshes well with our party with our partnership with MySEMA. I can easily click in and check on monthly notes that are drafted for our patients between visits in a very concise manner that has significant meaning for me. It allows me also, with the integration that you guys have now with Veradigm, who's our EMR vendor, to automatically time capture things I'm already doing, so that time credit is given for chronic care management services on days I'm not seeing them in the office. So that's a very slick offering as well. But really, just the wholesale software offering, and certainly the partners that you have, Matt, with Blake, et cetera, have been really just been a joy to work with, and we have no reservations whatsoever to recommend Chronic Care IQ to others.
Well, I've been in ambulatory practices for the past 25 years. I've even deployed software to the largest hospital in the Southern Hemisphere. And I can honestly tell you that what both of you have done, you rank right up there with the best of the best. And thank you for doing this for us. And whatever we can do, whenever we can do it, please just let us know.
Thank you, Matt, for that great overview. Now, to help bring some of these concepts to life, we're going to walk you through a short demonstration. Blake will show how Chronic Care IQ integrates directly with Veradigm to simplify care management operations, streamline patient enrollment, and drive meaningful financial results for your organization. Blake, take it away.
So typically how I do these overviews is I will break it up into 3 buckets as to how we might be able to help your practice. So clinically, financially, and operationally. And essentially what we do is we engage patients at their individual technology comfort level, and we send them questions automatically. The questions that we ask, the frequency at which we ask them, and how we rate when patients are trending outside the lines, those are what we call clinical monitoring protocols. And these questions or protocols can be sent to your patients in a few different ways. So via secure text, email, a mobile app that the patient themselves or their adult child or caregiver can download and respond to. But again, as we all know, these are elderly folks. Not all of them are tech savvy, and that's totally fine. In that case, what we would do is we'd alert your care management team and say, hey, here are the patients you need to reach out to today, but also here's a care journey or a question journey to take that patient through over the phone. Over the last 11 years, we've had the privilege of working with providers to help us develop over 600 different monitoring protocols in our platform. The big ones, right? Hypertension, type 2 diabetes, heart failure, COPD. The point is there's an entire library of protocols in our platform, and they are also customizable. Mr. Rodriguez is a heart failure and hypertensive patient who is triple enrolled in APCM, which is a new code for 2025, CCM and RPM. For RPM, we integrate with 8 different device companies. Devices can be shipped through our UI, delivered directly to your patient's home. And the nice thing about our device partners is they use cellular connected technology, meaning if I am a patient of yours and I receive a blood pressure cuff or a scale, all I have to do is take that device out of the box, take my blood pressure, and that blood pressure reading is sent back in automatically. I don't have a device to demo to you right now, but I will show you if I'm a patient of yours. If you have patients that are self-reporting their blood pressures or recording a blood pressure log, they can self-report those with us, and you can bill RPM time. So if I'm a patient of yours and I enter in a reading that's not normal, right? Say 189/99, we will detect that and then populate a new question to the patient saying, hey, did you take your medication today? So based on how your patients engage, if they're engaging digitally or if they're engaging with your staff over the phone, we'll guide that patient along an entirely different question journey depending on how they answer. And some of the questions that we might ask a patient with heart failure are questions like, have you noticed any new swelling? Do you find yourself short of breath? How many pillows did you use to sleep with last night? How do you feel in general? Patient retention with these programs is everything. We are proud that we have an 87% patient retention rate at the 1-year mark, meaning 87% of the patients that start engaging with ChronicCareIQ, they are still active and responding 1 year later. And if you guys have done already, I would encourage you to go to the Google Play or the Apple App Store and go and look at some very real patient reviews. So if I go to, just go to newest here, you are going to see hundreds of 5-star reviews from patients, I promise, not named Roy Rodriguez. Now, when the patients respond, I'm going to sign in as a case manager named Emma Peel. When the patients respond, their responses are scored red, yellow, green on this color-coded dashboard. The nice thing about the Veradigm integration, it's a complete integration, and all of your patient demographics will flow into our platform automatically, so you won't have to worry about adding patient after patient manually. The integration will do it for you. But the short of it is when I come in as Emma Peel, the very first thing I see is red, yellow, green. That red, yellow, green gives me the situational awareness of who's at risk, right? Who's trending in the right direction, who's trending in the wrong direction, who do I need to get a hold of now? And I'll start with my reds. So if I click into Mr. Rodriguez's chart, I go from having that situational awareness of my entire patient population to now I can dive into Mr. Rodriguez to where I have some actionable intelligence as to why he needs me in the first place. If I scroll down, all of his responses, vitals, blood pressure readings, it's all here. It's great data. I think it's quite a few numbers, however, for me at least to look at. So what we do is we give your patients a response score. That's what that 90 number is. And very simply, the way response score works is the higher the number, the worse off the patient is. So if Mr. Rodriguez answered every question in the worst way, he would score 100. And that simple response score gives your clinical team a way to normalize the patient responses over time as the questions evolve based on how the patient is engaging with the platform. And the other graphs, right, if I have RPM turned on, let's say for weight or blood pressure, it's a very easy way for you to see how the patient is trending. I tell people this all the time. We don't have a chronic care problem. Plenty of providers, right? Dr. Hammett clearly knows what to do. The problem, however, is oftentimes he might not know when. So really what we have is a chronic communication problem. We're a communication platform that bolts onto Veradigm and also integrates with over 30 different telecom vendors to bridge that gap between you and your sick and fragile patients when they're not in the clinic. That is the clinical flyby. The next piece is how these codes work, how they reimburse. Medicare, if we back all the way up to 2015, Medicare came out with CCM, chronic care management. At the time, it was 5 CPT codes. The base care management code 99490 in 2015 reimbursed at $42 for 20-minute increments of non-face-to-face clinical time. If we fast forward all the way to today, There's over 8 different connected care code categories, 25 plus different unique reimbursement. It is clear that Medicare is driving care in this direction. And the way that most of these codes work, for the most part, is they're based on increments of time. For the most part, 20-minute increments. And when you look at the activities that are lumped into that time, it's the work that you and your clinical team, they're already doing, right? On the phone with patients, communicating with caregivers, doing medication refills or reviewing labs inside of Veradigm. But the problem is if you don't have a system to help you track that time in those activities, it's death by 1,000 cuts. And that is where care management fails. So unlike many other platforms out there that are just simply a timer, right? You click start, you click stop. We don't have a timer that you have to click start and click stop, because quite often you might forget to click stop. So the timer runs in the background. So Mr. Rodriguez triggered an alert. I'm coming into his chart to take a look at his blood pressure logs. Maybe I need to export his blood pressure summary to send to cardiology. I'm seeing if there are any patient messages, and I go back to the dashboard. All of that chart review time was tracked for me. The third piece, like I mentioned earlier, we integrate with over 30 different telecom vendors. A lot of this care management activity is spent on the phone. So we integrate with many phone systems. Now, we don't listen to the calls, we don't record the calls. What we do is we scrub the caller ID logs, we throw out the non-clinical extensions, and we also throw out the hold time. We then track any outbound call that is made to, or any inbound call that is received from, numbers associated with patients. And you will be absolutely amazed by how many increments those 20 minutes add up to when we track the telephone calls, right? We eliminate the death by 1,000 cuts. The fourth piece, like Dr. Hammock mentioned, is the work that they are doing inside of their EMR. And they do these activities every day, right? Routine activities like medication refills, prescription changes, reviewing labs, imaging results. We pull those activities over from Veradigm automatically and timestamp all of those activities with an easily defensible amount of time, right? We are like a broom that sweeps up the work you're already doing and converts it into an average of $103 per patient per month. Once we have it, we send it back to you in the patient's chart in Veradigm at the end of the month in an audit log, protecting you if there's an audit. And our billing dashboard, which is also integrated with Veradigm, is going to tell you, here are the patients to bill, here are the codes to bill them for, and here are the combinations of the 20 plus different reimbursements that are correct, because some of these codes conflict and some of them complement each other. So the heavy lifting from a billing standpoint and a code assignment standpoint is done for you, right? That's the financial piece. If you want to do chronic care management, number one, you need to know who to care for and when to care for them. Number two, you need to get paid for it, right? Because it's work you're already doing. And the third piece is probably the most important, because if this is not easy for Emma Peel to use, it's not going to work, especially at scale. So when I come in as Emma, the very first thing I do is click show. This is going to tell me everything I am supposed to do before I leave the clinic this afternoon. So here I can see I have 8 patients that have exceeded a clinical threshold. Well, we already spoke with Mr. Rodriguez. Dr. Ethington made these medication changes, right? I'm going to mark his chart as reviewed, and now it updates telling me to get a hold of these 7 patients here. So clinically, we tell you, did you give your patients the right attention and the help they needed when they needed it? Transitioning over to time, right? That's how these codes work. That's how they reimburse. Tracking time, very easy. So if I go to my time summary graph, I can see it here. I can sort by time down below, but I also have a monitoring task toolbar protecting me from things falling through the cracks. And the very last thing I'll show you, and then Matt, I'll pass the ball back over to you, is we have tracked over 2 million hours of call data over the last 10 years. And what we've learned with that is an increase in call frequency and or call duration is oftentimes a great indicator of a rising risk patient. So we can proactively point these patients out to you and your clinical team. And again, keep in mind, these are patients that are not active or enrolled, right, in your CCM or RPM program today. Rather, patients you might want to consider enrolling because we detected they called your team 3 times this week already. So I can see I have 1 patient that fits that criteria. It's Alan Pearson, and I can go in and activate that patient there. So that was a crash course in Chronic Care IQ. If you'd like to learn more, get connected with us on our website and book some time with one of our sales team members.
Thank you, Blake, for the demonstration. And thanks again to everyone who joined us today. And certainly a special thank you to Veradigm for including ChronicCareIQ as a platinum partner and June App of the Month. As a quick reminder, for those of you who attended, you will receive your personalized financial analysis following today's session. And remember, Veradigm customers also qualify for complimentary implementation and training with ChronicCareIQ. If you have any questions or would like to schedule a one-on-one consultation, please don't hesitate to reach out. On behalf of ChronicCareIQ and the Veradigm teams, thank you again, and we look forward to helping you grow your care management program.